The modified Apley scratch test. The Apley scratch test is an excellent evaluation tool to uncover a number of dysfunctions that may be present in the shoulder joint and upper back. We specifically look at the level of shoulder mobility, identifying the level of internal and external rotation. In addition, we use it to identify the level of thoracic extension present in the upper back. This is crucial for overall performance and maintaining healthy shoulders. The setup. You'll need a bench to sit on to perform the test. Set up a camera to film you from behind, and ideally you'll do this shirtless or in a singlet to have the shoulders exposed. The test. Sit on a bench or backless chair, raise both your arms to the side, keeping them at shoulder height, and make tight fists. Push the arms out as wide as they can go. Whilst maintaining a closed fist, reach the right arm up and overhead, and then reach behind the neck and touch down the upper back as far as possible. Now with the left arm, reach out and place your hand around the lower back and reach up as far as possible. Don't force this position, simply try and get the two hands as close together as possible. Now repeat the test, but this time your left arm will go up overhead and down behind your neck, and your right arm will come around the lower back and reach up the spine. Review the video and take note of the distance between the two fists. What it should look like. Try not to overextend the lower back as you reach around. Contract your abs to prevent this from occurring. However, we do want to see some extension take place in the upper back. Maintain closed fists at all times. As I said before, don't force the position. And keep a neutral head position at all times. Indication of dysfunction or issues. Review the video and take note of where each hand ends up in the test. The main thing that we're trying to identify here is a discrepancy between the two sides. Most people will feel a tightness in their dominant hand when reaching around from the lower back upwards. This is very common, but will need addressing. In those with an adequate amount of shoulder mobility, the hands should come within 1.5 hand lengths of each other. This is roughly around 30 centimeters. Also take note of the amount of upper back thoracic extension that takes place in the upper back. What to do? Record your findings in the movement assessment sheet in the toolkit. You have passed the test and do not have to perform the secondary upper body tests if the distance between your hands on both sides is 30 centimeters and or less, and that if there is no more than a 2 centimeter discrepancy between the left and the right sides. However, you will need to complete the upper body secondary tests if the distance between your hands on one or both sides is greater than 30 centimeters, or you have a discrepancy of more than 2 centimeters between the left and the right sides. So, for example, if the distance between your hands with the left hand overhead is 30 centimeters, but the distance between the right hand overhead is 25 centimeters, you'll need to perform the secondary test, as although the distance between the two hands on both sides is 30 centimeters or less, there is still a discrepancy of 5 centimeters between the sides. And as previously mentioned, this test also identifies your ability to extend the thoracic spine. So if you're unable to extend the thoracic spine, please refer to the thoracic extension exercises in the corrective exercise section of the course.